Hello, Worcester. I'm Trent Taros, and this is Health Matters, a show sponsored by the WCCA and the WDMS, the Worcester District Medical Society. I'm lucky enough to be joined today by Dr. Mark Maxfield. Dr. Maxfield is a thoracic surgeon at UMass Memorial Medical Center. He is also an assistant professor of surgery at the T.H. Chan School of Medicine. He began performing robotic surgery in 2016 during his cardiothoracic fellowship at Beth Israel Deaconess Medical Center in Boston. We've been lucky enough to have Dr. Maxfield here at UMass since 2018, where he's a leader in robotic surgery. Dr. Maxfield, welcome on the show.
Thank you, Trent. Thank you for having me.
Yeah, absolutely. We're happy to have you. So, Dr. Maxfield, could you tell everyone at home, what is robotic surgery?
Sure. So robotic surgery is a form of surgery whereby a surgeon will utilize some type of robotic assistance to perform an operation for a patient. And so to kind of give you a description of how this actually works, patients will come into the operating room just like any operation. They'll undergo anesthesia, and then at that point, the surgeons will use anywhere between 3 and 5 small incisions, just like a minimally invasive surgery. They put ports into the patient, and then what they do is they dock the robot to the patient. At that point, the robotic instruments are inserted, and once that's all taken care of, the surgeon will then sit down at a console. And a console is a portion of the robot that's in the corner of the room, and the surgeon will actually sit down. There's 2 instruments for the hands, there's pedals for the feet, and at that point the surgeon then controls all 4 different robot arms and is able to perform the operation.
And now, if I understand robotic surgery correctly, one of the major differences between it and other forms of minimally invasive surgery, laparoscopic, things of that nature, is that the robot actually sees in 3D. Could you talk a little bit about that?
Sure. So you're right. I mean, there are certainly other minimally invasive options for surgery, but the robot does have some distinct advantages over the other alternatives. And one of them, as you note, is the visualization. So as part of the robot system, there is a camera, and the camera offers a 3-dimensional view of the cavity in which the surgeon is working. The fact that the robot arm is holding the camera keeps the view very steady, and the surgeon, he or she, can control the view just by using the instrumentation of the robot. So one of the advantages of robotic surgery is the actual surgeon is able to control 4 different arms. The surgeon will control the camera. The surgeon will control a second arm that we usually use for things like retraction to kind of get the view correct for the operation. And then the surgeon controls the 2 arms that actually do the work.
And I will say an underappreciated benefit of robotic surgery is that you are saving many medical students' arms from the torture that sometimes is holding up the laparoscope. So
yeah,
we definitely thank you for that.
Absolutely. Yeah, the robot does all the work in that respect.
Definitely. So how did you start doing robotic surgery?
Sure. So I started really back in 2016, and this is when I started training in cardiothoracic surgery. Robotic surgery has been around for over 20 years, and since then there have been a series of improvements in the technology. I was trained as a surgeon, and that means that I learned how to do open surgery, minimally invasive surgery, and robotic surgery, and that's really important. The robot, which is made by Intuitive Surgical, the robot system is just a platform. It's a way in which surgeons can provide optimal surgical care and do the operations that patients need. And so And so, yeah, getting back to your question, I did start in 2016. At that point, when I was training, I was using it about once a week. And then when I came to UMass in 2018, at that point, UMass had 2 robots, and they were one of the older systems. But then finally in 2019, we got the most up-to-date version, which is called the XI, which really was a transformational leap in terms of robotic technology. The XI over the previous editions, much more user-friendly, much easier to use, much easier to train people to use. And since then, since 2019, UMass has gone from 1 XI system to now 4. Wow. So we have 4 XI systems, and at this point in my practice, I'll usually do somewhere between 10 and 15 cases per month.
And I think it's really important that you noted that surgeons are trained in a variety of methodologies, and this is one of them. Open being another one, laparoscopic we've discussed. When you transitioned to using robotic surgery, what was that transition like for you?
That's a great question. Certainly prior to using the robot, as a surgeon, you really have to know the technology, you have to know the system, and there are very good training programs sponsored by the company that will allow surgeons to learn how to use the equipment safely. There's also very good simulation programs, and that is another advantage of robotic surgery. As a platform, it's much easier to train people and to teach people robotic surgery because of the role of simulation than other forms of surgery like open or minimally invasive. There are some fields, in terms of training pilots, some fields have really leaned into simulation as a way of preparing people to teach them to do things prior to them actually doing it. And I see that within surgery, with the advent of robotic technology and its increased use across the country, I do think that we're going to see more and more simulation implemented as part of training algorithms.
And I think that's really important. I don't believe that you're aware of this, but I actually sit on a lot of the simulation committees at UMass, and I agree with you. I think that medical education as a whole is moving more towards a simulation-based model, and I think it's very good for all of our patients out there. Could you talk a little bit, Dr. Maxfield, about what procedures you are performing on a day-to-day basis using robotics at UMass?
Sure. So I would say the most common operation that I do is a robotic lung resection, and that's where a patient who has either a concerning lung nodule or some type of a lung cancer will come in, and then using robotic-assisted surgery, I'll remove that portion of the lung, usually the draining lymph nodes, and then recover them. So that's the most common operation that I do. But in my practice, I use robotic surgery to perform lung resections, to perform what are called diaphragm plications for patients who have a floppy, high-riding diaphragm. I use them for esophageal surgery, so that would be things like esophagectomies. If a patient has a mass in the anterior mediastinum, or if they have something like a thymoma, then I'll do a robotic thymectomy. And then I also use it for operations through the belly on the esophagus. So that'd be patients who have a hiatal hernia or paraesophageal hernia. You could do a robotic repair of that, or a robotic Nissen fundoplication for patients who have GERD.
That's fantastic work. I can't imagine the relief those patients get. That's incredible that you're able to do it in such a minimally invasive way, truly.
Yeah, I mean, there are a lot of different advantages for patients who are undergoing robotic surgery. Patients in general benefit from minimally invasive surgery over open surgery. It is very clear that patients who have minimally invasive surgery, they have less pain, They have a lower risk of bleeding. They have a faster recovery. They spend less days in the hospital, and they have a quicker return to their normal activities. And years of performing minimally invasive surgery have demonstrated this. In particular, though, with robotic surgery, it's hard to quantify the advantage of robotic surgery over minimally invasive surgery like laparoscopy in terms of the patient outcomes. But as a surgeon, it's very clear to me that when I compare a minimally invasive option versus a robotic option, as a surgeon, the robot has very distinct advantages. Robotic instrumentation allows for very fine movements, very precise operating, and the actual instrumentation offers many degrees of freedom, which allows surgeons to do precise surgery within the body. As we noted before, the visualization of the robot is excellent. And then the ergonomics for the surgeons are much better in robotic surgery than minimally invasive. I mean, the fact that the surgeon, once the robot is docked, the surgeon can sit down and can focus more on the patient than maybe about their sore back, I think is in the patient's benefit.
I definitely agree, and I think ergonomics is an often ignored subject in surgical training. That I think as our doctors gain longer and longer longevity will come to the forefront more and more. You've kind of answered this, but my next question is: do you feel that robotic surgery is better than other forms of surgery, whether they be open or maybe other forms of minimally invasive surgery?
The answer is yes. And I could say that as a surgeon who performs open surgery, minimally invasive surgery, and robotic surgery. And the reason is that is really what it comes down to is actually the conduct of the operation. Like I said, there isn't a whole lot of difference between robotic surgery and minimally invasive surgery in terms of what the patients experience in terms of pain or the incisions that they have or the scars. But the real difference, though, is in the conduct of the operation, which is what is the surgeon actually doing. There is a level of visualization, of precision, of accuracy of the operation when we use robotic technology that really is very hard to mimic using other minimally invasive options. And so as long as a patient is a candidate for minimally invasive surgery, then absolutely I would prefer to use the robot.
And when you say are a candidate for minimally invasive surgery, what sort of things make somebody a candidate for minimally invasive surgery?
The vast majority of patients are candidates. It's pretty rare that a patient would not be a candidate, but usually if someone's got such bad heart or lung disease that they can't tolerate something like general anesthesia or insufflation, but that's pretty rare. Another issue that I sometimes have to deal with, if someone has a lot of scar tissue within their chest or within their belly, then that scar tissue will inhibit the ability of the surgeon to perform something in a minimally invasive option, and then so that would mean that we'd have to do open operation, the old-fashioned operation.
And we've talked a little bit about the superior optics, the superior degrees of freedom, and the superior ergonomics from the surgeon's standpoint. Do you think there are any other benefits to robotic surgery over other forms of surgery?
I think that question kind of ties into the current state of technology and kind of where we're going. The current system for robotic surgery and the kind of improvements that we see coming, there are a lot of there's a lot more focus on computer-aided surgery. There's a lot of intraoperative adjuncts to surgery that allow surgeons to perform safer and more accurate surgery, like intraoperative injection of certain medicine that helps light up anatomy. And so I think, again, the advantages of robotic surgery are significant, and I think they're only going to get better over time. Right now the main system is the XI, but there is talk that there will be another system being released sometime in the next couple of years. What I think and what I hope is that, as with most technology improvements, the next system will offer more advantages over the current. Perhaps there'll be smaller ports, so even smaller incisions than what we currently use. Right now, for robotic ports, that is a port is the incision that's made in the side of the patient. The size is either 8 millimeters or 12 millimeters, and what we're hoping for is that those numbers go down to 4 or 8 millimeters in the next system.
Wow, that would be incredible. I mean, that is, for those of you at home who don't have a good grasp on what 4 millimeters is, this distance is about 15 millimeters. So, take my thumb and divide that by 3, almost 4, and you're talking a truly tiny incision there. We're talking a little bit about innovation here, Dr. Maxfield, and I was wondering if you could touch a little bit on the innovation that's happening at UMass within robotic surgery.
Sure. So I think, to start, if you think about what we have at UMass in terms of our robotic fleet, as I mentioned, we have 4 of the XI systems. We have a 5th robot, which is called the SP. That's a single port system. We have the Ion, which is a robotic navigation bronchoscopy. And then we also have, there's some robots that are used for orthopedic procedures. The Ion navigation bronchoscopy, which is where a robotic technology uses navigation that allows the surgeons to isolate the location of a lung nodule to improve the diagnosis of the biopsy, has been at UMass for now about a year, and has really dramatically improved the ability to diagnose lung nodules that are concerning using bronchoscopy. And so with the improvement, with the start of that technology and its really rapid improvement and its utilization, we in thoracic surgery partnered with our colleagues in interventional pulmonary, and we developed what's called the RODAT procedure. RODAT stands for Robotic One Anesthetic Diagnosis and Treatment Procedure. And this procedure is geared for patients who have a concerning lung nodule, concerning for something like a lung cancer. Traditionally, these patients would have a bronchoscopy and some kind of a biopsy in one setting, wait a week for the results, wait another week to meet their doctor to talk about the results, and then if they need surgery at that point, schedule the surgery and wait another 2 or 3 weeks. What the RODAT procedure does is that decreases the time, and we do it all in one setting. So a patient with a concerning lung nodule will come into the operating room. They have a robotic navigation bronchoscopy and a biopsy. In the operating room, there's a cytopathologist that actually grabs the biopsy and looks at it, and then he or she will determine if it looks like cancer. If it doesn't look like cancer, that's great news. Everybody kind of claps, and we wake the patient up and we let them know the great news. But if it is cancer, and of course we've spoken about this with the patient beforehand, but if it is cancer, then at that point we proceed with surgery, which would be some kind of a robotic lung resection. And then when we get done, the patient wakes up, and they get either they wake up and they get the good news that it wasn't cancer, or they wake up and they get the news that, well, it was cancer, but now it's gone. So
that's incredible, and I think that really speaks to something that I see in my experience at UMass quite a bit, which is that many different departments, For viewers at home, Dr. Maxfield is talking about three distinct departments there: interventional pulmonology, cardiothoracic surgery, of course, and the pathology department. And just seeing them work together in that concerted effort is just, it's incredible to think about. And, Dr. Maxfield, everything we're talking about does just sound so space age and so futuristic. I kind of feel like it should be, on Star Trek or something. As an expert in the field, what do you think the future of robotic surgery really looks like?
That's a great question, and I think an exciting one. I often think this is my 5th year of practice, and I always I tell medical students and residents and even colleagues that when I retire, I suspect that there'll be a robot in every operating room in the United States. And the reason is that the technology really is improving over time. I do think that with the next generation of robots, you'll see smaller incisions, you'll see improved accuracy of the instrumentation, you'll see better visualization and better cameras. I also think that there'll be more computer-aided surgery where they'll use preoperative CT scans to overlay anatomy to assist with difficult anatomy, and increasing use of adjuncts in the operating room to help visualize the tissues or concerning anatomy to help the surgeons perform safe surgery. I also think that there will be, as we spoke about earlier, there'll be a pretty significant push towards increasing the amount of robotic simulation for surgical trainees. We're kind of at that, there's an inflection point that we're nearing where the technology is getting so good, and there's so much that trainees can do outside the operating room to prepare themselves to operate, that I think we'll see more and more of that, that ultimately will help the trainees become safe and competent surgeons, and that will in turn help patients get the surgical care that they need.
That's just incredible. The future truly is bright, especially at UMass and especially at UMass Cardiothoracic. Dr. Maxfield, we only have time for a couple more questions, but when I do these interviews, I like to get to know the human Dr. Maxfield a little bit too, as well as the robotics expert. So for those of you who don't know at home, many surgeons have playlists that they like to play in the operating room, things of that nature. Dr. Maxfield, do you have a go-to playlist? Do you have some go-to artists that you can share?
Yeah, that's a good question. The choice of music in the operating room is important. If it's too fast, then you don't want to kind of get too excited when you're operating. Whereas if it's too slow, you don't want to fall asleep. And so I used to listen to this band called Sohn, kind of an obscure band, SOHN, and the nurses in the operating room, they used to complain about it. That was when I was doing less robotic surgery. When I do robotic surgery, we don't have any music playing, and that it is important to not have any, because you want to be able to communicate, and the surgeon is in the corner for much of the operation. So hearing everything is important.
And actually, that brings up a good point that I think a lot of people don't think about with robotic surgery, which is it really is such a team sport, because you're coordinating not just you, but also potentially a resident, a scrub nurse who's actually at the bedside changing out arms. Could you talk a little bit about maybe what that process is like and the teamwork required?
Sure. I mean, you're spot on that robotic surgery is a team sport, and surgery is a team sport. There's no operation that a single surgeon can perform just on their own. And so, when the patient rolls into the operating room, they're greeted by the anesthesia team, and the anesthesia team will take care of the patient when they're under anesthesia. At the bedside, there is what we call the first assistant, and that's someone who's at the bedside, and they also have instruments that they could use to help assist the surgeon. There's also what we call the scrub technician, and that's a person that helps with the instrumentation.
And Dr. Maxfield, just like most surgery, or actually all surgery, I should say, robotic surgery is done completely sterilely. Could you talk a little bit about how you kind of prepare everything and maintain sterility in an environment where you are going to a console?
Sure. It's very similar to open and other forms of surgery. We use a very something called chlorhexidine, which is a very good way of cleaning the skin prior to starting, and that does a very good job of sterilizing the skin so patients don't get wound infections. We use standard draping to make sure that the field is clean and not contaminated. And then the robot is also what we call draped. So after every case, the robot is cleaned, and then to start a case, it's draped so that it maintains that sterile environment. In addition, all the instrumentation that's used is cleaned in our sterile processing department, just like is the standard for just a standard instrumentation.
Fantastic. Well, Dr. Maxfield, I'd like to thank you so much for coming on Health Matters. I think you've really kind of pulled back the curtain a little bit on robotic surgery, definitely made it a little bit more approachable. As Dr. Maxfield has proven today, it's just a fantastic option and yet another example of innovation happening right here in Worcester. On behalf of the WCCA, the Worcester District Medical Society, this has been Health Matters. Please tune in, channel 192, or you can tune in online, 194.